My name is Jenner Perez. This is
Taylor Molina.
and we're here to present our project for Clostridium difficile enterocolitis, also known as Diff, for our microbiology class of fall 2025.
So let me introduce you to Frank, a 67-year-old man who came to the ER with cramping, loose stool, and a fever. After speaking with the nursing staff, it was revealed that Frank had been on antibiotics the week prior for a different infection. These antibiotics disrupted his gut bacteria, allowing C. diff to overgrow in his gut. They did a stool sample, and the test confirmed that the infection was C. diff, and Frank was treated with vancomycin for 10 days. All right, so let's talk about what is C. diff. C. diff is a bacterium that causes inflammation and bacterial overgrowth in the colon, known as colitis. It often develops after antibiotic use, disrupts healthy gut flora, and it can enter the body orally. So there's like two different ways that it can come into your body. In severe cases, it can cause a toxic megacolon, a life-threatening condition where the colon can't move gas or stool. Talk about some characteristics of C. diff bacterium. C. diff is a gram-positive, spore-forming bacteria that thrives in environments without oxygen, meaning it is anaerobic. It produces toxins that can permanently damage the intestinal wall, and in severe cases, it's even life-threatening. I'm going to go over some of the signs and symptoms of C. diff. Common symptoms include watery diarrhea 3 or more times per day, fever, abdominal pain or cramping. Patients may also experience nausea, dehydration, and loss of appetite from the body fighting off the infection. Some media just so you guys can get a concept of what the bacterium looks like. We have both the actual bacteria and the spores that actually form on surfaces. I'm going to go over some of the signs and symptoms of C. diff. Common symptoms include watery diarrhea 3 or more times per day, fever, abdominal pain or cramping. Patients may also experience nausea, dehydration, and loss of appetite from the body fighting off the infection.
C. diff produces toxins that damage the lining of the intestines, causing inflammation, ulcers, and in severe cases can lead to dangerous conditions like megacolon or sepsis, which both can require urgent medical attention. Recovery. Once C. diff is diagnosed, the first step is stopping the antibiotic that triggered it. Then, targeted antibiotics like vancomycin or fidaxomicin are used to treat the infection in cases where infection keeps coming back. A fecal transplant may be recommended. It is also important to manage dehydration with fluids and electrolytes. Prevention and hygiene practices. Preventing C. diff involves deep hand washing with soap and water. Alcohol-based sanitizers are not effective against these spores. We should use bleach to clean the surfaces and be really careful and responsible with antibiotics. Infected patients in healthcare should be isolated to prevent further spread of the infection. Colon damage and life-threatening conditions. It also has a high recurrence rate, meaning that even after being treated, it can come back, especially in older adults or people with weak immune systems, since their defenses are not the strongest against this pathogen.